Welcome to another exciting episode of the Bold Exchange. I'm here with Dr. Misheck Rwende. Doctor, welcome to the show.
Thank you.
Like when you finish your final year of like, aren't you guys allowed to graduate before you pass the exam for the bad handwriting? Because I find that every doctor has a bad handwriting.
And of course, that's one of the ways to say this is a qualified doctor. Should you have a bad handwriting?
Yeah, and like,
where to confuse you.
and like, where do you, just so that we do a background check, so that we do our due diligence.
Yeah.
In South Africa, 3 weeks ago, they busted 120 fake doctors. So just to make sure you're not a fake doctor, where did you like do your study, your medicine?
Medicine. So it was the University of Zimbabwe.
Ah, nice.
2013, graduated 2019.
So you actually always wanted to be a doctor when you like grew up, like I told you.
I think so, because I started around Form 3 when I was doing biology and physics. And when I got to Form 4, I had an A in biology and then a B in physics. So it was either engineering or Chiremba.
Serious?
So because I had an A in biology, I then chose Kutashi Chiremba. But also recently, I posted something by internet, and then my mining Kumusha was saying that when you're still very young, and spakaita embwa yakafa yangu, but I was still young by then. Ndikabva ndaicheka kuivhuya yanzi it was pregnant, that dog.
You're not serious?
So ndikabva ndaicheka kudii kuda kunoti ine vana vakawanda sei. Saka I was fascinated, ndikangoti no, I think so by then, as young as then, probably zvazvingori more. But I unoziva, even handiti kumaprimary kwai une muchingoziva kuti I want to be a nurse or soldier or policeman. Those are generally the professions that we are aware of. But as you be going, like I'm saying, Form 4, and ndopatata no picture yekuti Chiremba anenge ari right.
Taona wakapaka GD6 pants apa. Like you know, medical practitioners, you always got this love-hate relationship you have with your guys' employers. Like what mnonyazvisana papi chaipo because ndofunga kuti doctor kutozi munhu doctor ano stethoscope nechichi you actually mndowana unowana mari yakawanda mune muchinesana nechiko nemuteam iri
netimu repi
team rinokupai graft like you got this relationship yamunayo, or I don't know whether the social media exaggerates it, the love hates relationship you have with the government and stuff. Like what happens there?
Yeah, so aiwa pamari apo
aikwani mara
imbofya yakakwana. And I think tofana kuaccept after this dynamics yekuti kudhara uchiremba waibhadhara, yes, kudhara world over, but now it looks like engineering is taking over.
Right.
Look at the people who are running the world now. It's more of engineers than Elon Musk, chichi. So machiremba tati dzikirei.
Interesting. Let's get to it, to the nitty-gritties. You tweet a lot about you got controversial tweets out there, and not controversial but very informative. I bumped into you during COVID as well. Mm-hmm. The first question I want to ask, so that we just get to the crux of the matter, I want to talk about a wide range of issues concerning sexual health, because a lot of people I don't understand it. I think you care about the youth enough to actually inform them about sexual health. Are people really aware of sexual health in Zimbabwe?
They are not. They are not, especially the young ones, or those we call AMA 2K.
All right.
Yeah. But not to say it's limited to them, because at times when we say AMA 2K, to visa vamwe vesawa. Let's just use the word. Let's remove the word AMA 2K and then concentrate on the young people.
All right.
You see, the let's say below 35. People are not aware of my issues in my sexual health. Right. Because you notice that even condoms are for free, and they are there in our public hospitals. But kutorwa kwawo and kushandiswa kwawo kushoma. Right. And panozoyapo maybe the issue of AMA 2K is just by general observation of increase of my sexually related infections, including HIV, right? That's why, if you remember, one of my tweets I was saying, I was advocating for the HIV mass campaigns, media campaigns, to come back because back then, if you can remember, the issues about HIV were everywhere, including to my book, to my primary, but now it's no more there. So these young ones are not aware of my dangers, HIV and so forth.
And but manje, I'll give a bit of pushback when it comes to nyama condom. Good, you know, no, like as when it comes to like condoms that are like distributed for free, most of those guys would be like, Nike. You know, you go for your other brands with anengane my textures, anengane feel their light, nishi. Amurupa mahara anenge card box. Anyasozo pinda nayo deep. So do you think that maybe it's a branding issue as well when it comes to that?
I don't think so.
Because punish much blue leopard, so I mean, don't you go to blue leopard? Don't you
but I think it's the most sensitive. Uchito compare ne acho amoda acho. Probably what you can talk about maybe is kutichiko, maybe you know it can break maybe easily.
Oh, serious?
In terms of sensitivity, that one is much thinner. Than imamwaya moda. So especially in a blue leopard gaga. But even when we're talking about it breaking, it's not like it easily breaks. Yeah. Obviously, trungo to compare a strength yacho. But otherwise, I think it was right.
Still on that I'm 2K and sexual, because at Ruafamba my age is when it comes to their sexual reproductive health, right? You're a big advocate for people to actually get tested for STIs. How many types of STIs? Which ones are more prevalent in Zimbabwe? Which ones are incurable? And how do you go about it? Because a lot of people will be like, yo, I can't go down and take out my pants and say, yo, nagaruma or whatever. So like, please elaborate more on that, on the STI issues.
Yeah, that one is it's a very big issue. And the problem with my STIs, especially in Africa, is that it contributes a lot to Nyazi fertility. So a huge number of people who are failing to conceive, be it the male or the female side, is caused by the untreated STIs. That's how big or difficult their situation is. That's why I'm advocating about that. Yeah, so that's one issue. So in terms of my STIs that we are generally looking at, number one, obviously HIV, right? But also number two and number three is the one that's called gonorrhea, the one that one comes with a discharge either from the penile discharge or vaginal discharge, right? And also the one that's called chlamydia. Kune mamwe, but these ones are the commonest ones that we are looking at. But the problem again is that most of the TB side HIV, most of the STIs, they're asymptomatic to majority of the patients. So now the problem is you can't tell kuti munhu ane STI here kana usina nekumuvhunza kuti wakamboita ma symptoms and so forth. That's why true bring in here kuti people must be tested for my STIs, because according to one study it was saying that 20% of the people in the ages of 18 to 24 in Zimbabwe, in the 3 provinces zakaitwa, they have my STIs. And majority of these cases, they are symptomatic, you see. So that's where it's coming in. It means these people who are symptomatic, they must be tested. And if they are tested, they are positive, they must be treated. I've talked about the issue of antibiotic resistance, whereby kana munhu akasapedza medication yake, especially antibiotic, if it is 7 days, munhu anofanira kupedza 7 days yake STI treatment. And also what's key there is anofanira treat with the partner. Why with the partner is because, like I said, majority of the cases are symptomatic. So if I come with a symptomatic STI and I get treated, but my wife doesn't get treated or my partner doesn't get treated, iye anenge ainayo. So in that, right, I'll go there, have a sexual intercourse with her and get it again. So it keeps that cycle continuous.
Speaking of the youth and speaking of the STIs amongst the youth, there was a bill that wanted to be passed in Parliament, and Idaho people were saying, let's give these school kids, my condom and contraceptives.
Yeah.
And, there was a lot of pushback. People were like, hey, our morals, you can't be picking your kids' lunch tin over Mr. Katsap, Kema condom item and stuff like that. So I'm saying, like, what's your take? Do you think it's actually wiser from coming from what you see in the hospitals? Do you think it's people should actually be considering giving these kids contraceptives?
I agree with that. I think the other problem is that we have to accept change. You see, things change, life is dynamic. Saka kuti tirambe isusu tichingoti no because kudhara kwatakakura isusu zvasingaitike but izvizvi zvakuitika. Pane zvinhu, there are certain things that we can't deny, that the young people, they are having sex and they are having it earlier, right? So we have to accept that, yes.
And they're having it in bulk. But
yes, and they're having it in bulk. And then, so if we keep denying, if we keep saying, no, azviite ma morals and so forth, but at the end of the day, what we're worried about is the health of the person. And kana munhu, those people, like I said, their sexual debut now is even much lower. They have sex, and if there is no contraception, they are having early pregnancy or teenage pregnancy has its own complications, including death, right? So we want to prevent that. So what are we saying? Are we saying that someone rather dies from teenage pregnancy against issue morals? I think what we have to put first is someone's life, which is we have to prevent death. And the second thing is we have to prevent sickness. By preventing sickness, I mean if we're going to use my condoms, condom is it works both as a contraceptive but also as it protects against my STIs, right? It means we are preventing HIV, we are preventing my STIs. Like I said, these STIs have their own issues, and also things like cervical cancer amongst our women. And what's also important, especially to the young girls, according to these are the studies, or even the World Health Organization, they say that in the ages between 10 to 19 years, right, 85% of those who are newly infected, they are girls, you see. So it means that we need those condoms. We need to teach them about the sexual health. It is important. We have to stop the transmission of HIV, if possible, in our generation. In fact, the World Health Organization says it is possible to end HIV in our generation. But for us to do that, we have to face my issues head on, not to.
That's like a lot of information on this on STIs and stuff. How hard is it for one to get tested at facilities in Zimbabwe?
No, it's not hard at all. And some of these STIs are actually tested for free. For example, HIV is treated for free everywhere, in all the public hospitals. Then kunema facilities, of those counseling centers, new start centers, right? And when you look at cervical cancer, we can call it an STI again because it's transmitted sexually, right? And now the problem is it is the commonest cause of death and sickness among the Zimbabwean women and the African women. But this is the commonest, the mostly easily preventable cancer, the cancer that has been well understood in terms of its prevention and its treatment. And the cervical cancer screening is absolutely free, right? So the thing is, if one is screened early, they're detected early for cervical cancer, that cancer can be cured. So it is one of the few cancers, cervical cancer, which is easily cured, but unfortunately, it is the most commonest cause of death among women.
How expensive is it to do these processes? Because like, how expensive is it to get tested?
No, it's for the other STIs outside cervical cancer and HIV. No, it's not expensive at all. It's just that people are not. I think people are just not aware, or we just don't prioritize these health issues. Because I'm sure with $30, you can get a good test, right? But think of that. Probably yesterday you actually used $30. We always use these monies, and just generally talking, I believe that if someone can afford to get an STI, really, they should afford to get $30. Because how are you getting it? If it is someone you are giving that person money, there are a lot of issues that are involved in you getting STI.
No, I hear you.
So $30 shouldn't be a problem if we are to be strict about it and put priorities in.
No, the reason I'm laughing is that the way you say that if you can afford, it's like you're talking about very low-cost, cheap STIs that are out there on the market,
Yeah, because really, we all know how we get these STIs. It's not like we get them as oxygen.
No, I hear. I totally get you.
Yeah.
Now let's talk fertility. How big of a problem is the fertility problem when it comes to people that you meet in hospitals in Zimbabwe? Is and what's the major contributor and my morning afters that people are actually taking, like, some people can take 5 a month. Are they supposed to be taken that way, or just please shed some more light on this?
So the issue of infertility is very high in Zimbabwe, just like in another African country. And the main reason, like I've said, is the issue of untreated STIs.
All right.
Right? Because these untreated STIs, if it's to a woman, they go up there to the tubes, they block the tubes. If it is to the men, again, they get inside and then they can cause a lower sperm count and other complicated things, right? So it's a main contributor. And then in terms of my morning after, what we encourage is use morning after once a month, right?
Saka 12 gore.
Yes, 12 per gore, but not necessarily saying that you have to count this month, just next month. If you see yourself using them more frequently, it means what you need is a contraception, right? Maybe you want a Jadeo or you want pills, rather use pills than abusing the morning after. That one is an emergency pill.
So most women argue that using the Jadeo or whatever contraceptives they use, they say it always messes around with their hormones, and it messes around with their weight. Are there any other safer? Majadel ndo green, so
Majadel ndo. But you see, the thing is, these contraceptives, there are many.
All right.
More than 8. So you choose the one that fits with you. It's not always. What we have to know also is every medication, every health intervention has its side effect.
Okay.
Right. Including that which we take every day. Yes, it's any, right. But the issue is it doesn't happen to everyone. So you look for the one that fits you. But just a general comment, there are those things like loop. The loop, it generally doesn't interfere with your cycle, or with your hormones, because they are called hormonal pills or hormonal contraceptives like Anajadel, those pills. That's why they interfere with the hormones. Some they go fat, and some they may have heavy bleeding. But then also another thing is some of these things, these side effects, they happen in the first few months. And then they go away. Because someone may be on the pills, but with no side effects at all. And then person B has, and then someone in Jadeo, no side effects. So it just depends with the one that suits you well.
Because, I the other time I once had a couple here that was telling me, this is on contraceptive, but I go Roma aspirin one, and then it messed up. And so is this contraceptive method you're telling me foolproof? 100% apana kamkomana kanongocheza no. We can't really say 100%, but some of these ones, they are 99.9%, and really some are, in fact, majority of them, they are over 98%. And remember that I haven't heard of any medical information that is 100%. All right.
But when we say 99%, that's 100%.
Interesting.
But then there are other, of course, rarely. And then what people also need to know is that there are other medications that can interfere with contraceptives.
Okay.
So we always need to be in touch with our doctors, our healthcare givers, about other medication that we are taking, because it can interfere with the contraception and then it lowers its effectiveness.
Let's talk men's health and just men going for checkup. Why are men scared to go for checkup, and why don't men go for checkup?
I think we just, number one is just not in us, right? This thing of health issues. Then number two, we don't prioritize it. And then number three, obviously, this issue that if you're a man, you have to be strong.
Yeah,
you have to
be. Hospital
kuti kufa kwemurume kubudaura, saka kubudaura kwakoka unge wanyatsa kurwara. Right? And then, but you also see that women there are more opportunities for women to be going to the hospital. They get pregnant, and when they are pregnant, they go to the hospital several times, and when they are there, they're tested for HIV, syphilis, and many other things. And when the kids are sick, you notice it's usually the mothers who go with the kids to the hospital. and all those are opportunities for the women to be taken care of. You will notice we encourage that when someone is going to be booked for pregnancy, and the encouragement really is pregnancy should be booked within the first 3 months. There are many advantages to that. You don't have to wait until you're 8-9 months for you to get booked. Because, for example, we were talking about the issue of HIV.
Yeah.
Right? We know that if you get booked within the first 3 months, you are tested for HIV. If you are positive, you are put on treatment. Within 1 to 6 months, you are on undetectable viral load with the medication that we currently have. It's very effective. What it means is that you can't transmit, or your chances of transmitting HIV to your child, they are reduced to 0.1%. That's virtually zero. So, but now if you come late, if you book late, and we are putting you on medication late, it means you are putting your child on at risk of getting HIV. It's one example of the complications, right? So it means our people have to be booked early for the HIV, especially for pregnancy rather, especially within the first 3 months. That's what we encourage.
Talking still on men's health, let's talk prostate and why is it important for prostate to get checked. And isusu sevarume wangu inini hangu personally asauti ndiri kuirowa wangu ndiri kunyatsoirowa zvokuisa ndichingoona chikafu kana chichiona chikafu ndichingochiona asauti handibelieve kuti I think munhu anenge achini ndotobelieve kuti ndichindaisa ndaiona like what are some of the greatest challenges and health risks that men are facing regionally and as a continent?
You talked about prostate cancer.
Yeah.
Yes. Prostate cancer, that's the commonest cancer. We said cervical cancer is the commonest cause of death in women, cancers. On the other side, to us men, or to men, right, it is prostate cancer. Right. That's how difficult it is. But kune zvinhu too, there's one that's called prostate cancer, then there's the one that we call BPH, right? Those two, BPH is not cancer, but that one, it's very common as someone grows older, from around 55 years up to when someone is around the age of 85, 90 years, you see more than 80% of us have this growth of it's not cancer, but that's the one, zoita kuti vanhu vazoiswe pamachube aya vange vakuiswa a tube, right? That's one side of it. But the symptoms, they are similar to the prostate cancer. The only difference than the prostate cancer, now it grows to the other parts of the body, and so it's very important. And I have noticed that generally in Zimbabwe, when you have those like my Father's Day, when you have there are many activities where different organizations host or do my free prostate free prostate awareness, where they'll be doing my screening. Those ones, men should partake them, because they are very important. Like I said, for any cancer, the earlier it's diagnosed, the easier it is to be treated, and the longer will be your life.
Trukufa.
Trukufa nenyaya yekuti isusu tinozoenda kuchipatara kana munhu anyatsorwara, especially kuvarume kuno kune dambudziko. Tinozoenda kuchipatara kana zvinhu zvanyatsa kudzimba. Pazvirwere zvese hazvo.
No, but because what I'm saying is that, like, still on men and coming to Nyaye South, BP, and why are men dying?
Oh, yeah, you're talking about
and why are men dying faster than, not that I'm saying it is a competition to die.
Yeah.
But I'm saying why are men dying faster than women? Like,
yes, generally, men, they die younger. Or generally, this is like a global thing.
All right.
But West in Africa, yeah, because like I've said, this issue of my health-seeking behavior, this is akadagwa as men, right? And then you're talking about the issue of salt. That is a big issue. Salt, excess salt, it causes, it puts you at risk of high blood pressure. We had no ones with BP, but this happens to everyone, whether it's a woman or a man. But I know generally it's usually the men who wants to add salt, momoriwo. So it's no, zvawapiwa izvozvo. That's okay. Ingoshandisa salt irimo. There's too much salt is putting us at risk of BP, on top of other risk factors that we are already facing, like my junk foods, like not mobilizing, or this that we call sedentary lifestyle. Wadrive wabva panapo waenda kumba wasvika wapinda mumba wadzokera kubasa wasvika kubasa wadya a burger, that is junk food, and it's now less of exercising. less of eating health, less of my vegetables. So all that in combination with my salts is putting us at risk of what we call my non-communicable disease. And now they are on sharp rise, especially in Africa. These non-communicable diseases, they are sharp rise. The diseases like hypertension, diabetes, my cancers. And the problem with diabetes, we usually call it the silent killer, because inotanga ichikudya mukati so, and by the time yazobuda ma symptoms inogona yatombokudya. And also what's important is 55% of people in Africa who are living with diabetes are not aware that they are diabetic. That's why you see me, tweeting about the issue of my regular screening.
I like when you mentioned the diet, and you're talking about the burgers and stuff. How important is the diet, and true is the food that we're being sold killing us? So it's usually 2-minute noodles and stuff. Let's talk about and you talked about salt.
Yeah.
And it seems like there's nothing that you can then say, yo, this is okay, because sugar food, salt. Let's talk about the diet in general. Like how do you, because this is a balanced diet, grade 4.
And when you talk about the
protein,
when you talk about the 2 minutes noodle, this is what we are talking about. Anything that's fast kubika, you should be suspicious of it, because it means it's a processed something. And these processed foods, my noodles, my baked beef, and so forth, all these fast things, right? These are the things which are putting us at risk of growing big, total obesity, and eventually my hypertension, heart diseases, and cancers, and so forth. The recommendation is that we say the healthiest diet is called the Mediterranean diet. The one, to run the Mediterranean area. But it's essentially this.
What does that entail? What does the Mediterranean diet entail?
Right. So it is exactly the same with the African diet. Yeah. So, but they say it's a lifestyle whereby, because kune makomo. So those people they'll be moving up the hills, whatever, and that means they were exercising vachita shed off at the weight. And then it was what we can call a plant-based diet.
Oh, okay.
Right, yes. Generally, a plant-based diet, if it is eggs, it's at maximum of 4 times a day or 4 times a week of eating mazai, 1 zai per week. If it is beef, not more than 5 times a week. My vegetables, it's every day. Mvura is the healthiest beverage. Ayo, no, pane pasna sadza rakadai so sigomo. And that's why I'm saying tingangoti zvakangofanana our African diet yekudhara yayai yekuti again it was more of a plant-based one wairima, and even nyama yaidya ipapo it was more of the yemusango yaya, right? And what you call the game meat. Yes, game meat. That one is healthy. It's got less fat, because the issue with the meat that we're taking now is about the fat content. So the game meat had less fat, but also people are planting, whatever. So that is the diet that we are encouraging. And kudara when you have long distances, it means they were exercising, right? It may be difficult to really say that saka munhu ngatingachadye rema game meat now trim town, trim Harare, or wherever city that you are in. It may not necessarily mean that, but what we are saying is we can mimic these things in a modern way. Right. For example, you always have to exercise. We encourage exercising at least 20 minutes a day of exercising, right? At least 5 days a week. We are encouraging a plant-based diet, like what I was saying, the African diet and the Mediterranean diet. More of my vegetables. Avoid my junk foods and my fries in my burger. Let's take more of zvinhu kumba, right? If it is beef, we avoid that. You see, beef is that white fat. We must scrape it off, because that is the one that is putting us. Because the problem with that fat is when it gets into our body through the blood vessels, it closes in there. You gara imomo, then you vara kuti ropa rirege kunyatso kufamba zvakanaka. So whenever you forget, just think of kuti zviri kudya vanhu vekumamisha ndezvipi. Handiti. So kana ukurunzi pabasa isusu will be encouraging kuti instead of maybe parking pa door peku office yako, you can park maybe 200 meters away. You give yourself time yekufamba. or when you're home you can have your issues my gym sessions or whatever, but as long as you're exercising at least 20 minutes a day. Less salt, we don't encourage you to waste the salt. Salt irimo yoyo ingodya yoyo. If it is fat, I've already said we should avoid the animal fat, not the vegetable fat, but the animal fat. The vegetable fat, yes, okay. And you mentioned about sugar. We are not saying don't take sugar, no. I start now modaro. There's one tweet that I said, it was sort of a controversial, that I said, sugar does not cause diabetes. These are myths that we're talking about. Sugar, no diabetes. That's not necessarily it. But we are, for someone with diabetes, no, we don't encourage sugar because you know quiz are sugar. But not to say we are prohibiting you from taking, just take normal. In anything that is to do with health is about the normal quantities, not zvakawandisa.
Still on diet, vanhu vari kurowa kambucha senge ameno mutaunu. How healthy is that thing? Is it healthy? Is it not healthy? Kambucha kamwe kanonzika chi ka wild kid kombucha, dragon, switch, zviri kurowa zvinhu izvozvo. Tell me about the health hazards of these unregulated. I mean, whether they are regulated or unregulated things.
But kombucha, I'm not sure of my ingredients. I haven't really looked at it. But ndikuona karungu advertise. Okay, so nikarongotaura kwese nema billboards nechichi. But mamwe aya mataura ana switch nemamwe matungomati ma energy drinks, right? Those ones ani high caffeine. Right, and that high caffeine, it has got its own issues, including addictive issues, and they're even more dangerous when they are taken with alcohol. Right. The other problem with them, because I've noticed as was generally, people they take them also one gonna go delta alcohol with it, but the problem is, it reduces your sensitivity kudhaka kwako. Yeah. So kana iwe wanga uchadhakwa ngatimboti nechiko ne 3 macos for example, anditi it means uchadhakwa ne6, but it means kuti iwewe hausikunzwa kudhakwa but
the system it was struggle.
Yes, processor
alcohol, liver, yeah.
So it means your liver is working too hard, it's burning, it's suffering inside, whilst you are still feeling okay. Those are some of the effects of my energy. So we don't encourage them. For me, I've never taken them and even time in medical school because atirare zvoumhanya kana kuchikoro hapana time yekurara ndechingo 6 years uchingo start, but handinambomatora hangu because I remember vamwe vedu pane umwe muchinda akambotora towards my exams, so I took it 6 days before because I told every day, then day exam hope zikabva dzanyatsozombata zvauya dzese. So those things inini I don't encourage them zvangu.
Right.
It's not something that I encourage my energy drinks.
So let's talk of still on the diet, but takubuda tichipinda mu street medicine. Town, I'm sure nombofamba vachinzi gonorrhea tea what pane anonzi appetito. Let's talk about street pharmacy street here. Unombona midzi chinzi like, tell me more, elaborate. What are the myths? Demystify some of the myths when it comes to street medicine that we actually see on the streets. Like people who sell this backdoor pharmacies. What are the dangers of this street pharmacy?
Those are you see, I know it's a sensitive issue because 80% of our African population, they are still using my herbal medicines. Even in Zimbabwe, it's the same. Those are the same statistics again. 80% of us are still using my herbal medicines. Yes, we are still using those ones. But the problem is, I believe there was a gap panapa from the older generation to our generation. Pakaita, some information was lost. The traditional medicines that we were supposed to be taking, right? That's one side. And also, it's also fit we should blame ourselves. Maybe kuvanhu vakadzidza kune kuma scientists kuti hatina kuzomboitawo ma research. Zvakafanana nezumbani yataishandisa during the time of COVID.
Makatomboishandisawo doctor?
Inini handina munhu wese akaishandisa.
Makakama doctor saka makashandisa zumbani doctor.
Zumbani ndesaka akashandisa. But it has proven to work. Right. inotoshanda, ine anti-inflammatory effects aina, inoshanda. But the problem is up to today, zumbani yakatanga kushandiswa mu Zimbabwe more than 8 decades ago, more than 8 years ago, but up to today, we haven't managed to extract that component that we are supposed to be using for flu. And if we had managed to extract that component, we were supposed to be using it even for COVID. Okay. So there was that loss of information from the generation to this one, but also the issue this is at nozomboda kunyatso kutsvagiridzo. So because of that information yakaluzwa ipapo, you see kuti ma quantities edata akushandisa ana guchu ana mchemedza main whatever, the idea will be there, probably the components will be there, but the quantities, we do not know the side effects, we do not know the right amounts, what is it that is effective. We have no idea about that. You will notice some of these things, if you start vomiting or having diarrhea, it means that you are cleansing the body. It's working, yes. Yeah. Yet it is a sign that it's destroying your body.
No, but why would you say it's destroying your body? Like me coming from I'm from an African perspective, because me that's like I really like respect my Africanism, right? There's a process, in some of our cultures whereby you have whereby it's you have to do it constantly. I think maybe once a week or once a fortnight, right?
Right.
Where you take unonatira and then you take stuff and then you then puke out, and as you puke out, it's believed to be healing your body because it's taking out the mucuses. When you talk of people like Anna Dr. Sebi, who actually came up with theories when they were saying that the disease usually is in the mucus. So maybe that's where it's derived from. But continue.
Yes, I get that idea. I've gone to this. It's a rich guy.
All right.
So kumba kwake is this home that he calls it detoxifying room.
Yeah.
Right, where you get in and then when it's come at temperatures, then you start sweating. And that is a different case. Here, when we are saying vomiting and diarrhea, it means you are losing too much water very fast.
Okay.
The problem is it's killing the kidneys. So these people, they usually come to a hospital with a kidney problem. That's one. Two, I have noticed again, someone akapiwa medication achinzi iguchu or mchemedza mai, the one, asked men to increase our performance.
Yeah.
Yes. One person was given that one, and then he was he started urinating continuously until he was urinating blood.
You're not serious.
It means that if now one is urinating blood, it means he has lost all the water. Now urinating blood, and it's a clear indication that even the kidneys have been damaged.
Shakes.
The kidneys have been fried, you see. So some of these things that we say is actually working, they're actually side effects. And now for this particular person who is urinating continuously, you can't stop it. It just has to stop until on board or until you come to the hospital, then we do some. So the problem is we do not know the side effects. We do not know are you underdosing yourself or you are overdosing yourself. So I don't have a problem with I do not necessarily have a problem with my traditional medicine. But what we need to do is we need now to do more of research. We need to know the doses. We need to know the effectiveness. We need to know the side effects. To say this particular medication, if you take it, it may cause this side effects. And when you have this side effect, what do you do? That information is not there.
I like where you are going with that when you're talking about we need to understand the dosage and stuff, and that brings me to my next question, where let's talk fake medication, because inini ndo believe ever since Brufen ratanga kuisa mune chimwe chipla arichanya so roa semaroyo raita Brufen randamborwa kudara, and Zimbabwe no say icho kwade roti Brufen rinopedza ama problem rinopedza zvirwere zvese.
Brufen
Let's talk about fake medication in your field.
No, really, there's nothing like fake medication on the conventional.
No, like counterfeit medication, because like it's a thing that's actually happening where people are actually creating counterfeit drugs. So let's say you are selling a drug for, let's just say hypothetically $20. Someone can come with a drug, the same drug, at $2. And it could be counterfeit.
Yes, I'm getting, yes. There are those. Zimbabwe is wrong to say in our hospitals. I've read about it. It's actually a business. It's actually
Because even like what you're talking about, Anam Chemezamai or whatever, people are being sold fake Viagra out there, stuff
fake,
like that. So there's a lot of fake, not fake.
Even my medicines, yes, it's there, but my encouragement now will be that you have to buy your medication from my reputable pharmacies and also kuenda kuma spatara. Because yes, wherever there's an original thing, it's very fake, it's not work, and even kuma medical field kwedu futi, that is also there, you see. But we have to be careful, and one way that we can be careful is kungotenga my medications in my pharmacies anengari reputable. And you're talking about the street thing again. Yeah. Another scam is those people who will be saying that full body scan $10. Full body scan, if you've heard of those people, I think kana wakambofamba ma streets eMararo.
I don't go there gonorrhea tea.
But you haven't seen Tim Ornoti scan $10 full body scan
for full medical.
No, now that you know so there are those people again who will be saying vanobira vanomari. Yeah, vachita full body scan for $20, whatever. And again, there are many cases that I have seen in my group media machiremba mune mchingo postwa munhu anonzi ndanoita scan obva asangana netimu rairari munhu anenge anzi ndanoita scan ichibereka obva asangana netimu obvanzi haisisi togona kuita the whole body 20 years uya nescan yaya kuchipatara. The scan doesn't show anything. The scan yechibereko on its own it costs about $20. So for a full body scan to be costing 20 years, that doesn't make sense. If it is to be anything like a full body scan, then it would be maybe $1,000 or $1,000.2. So there's nothing like that. I thought I should also touch on that one.
And now talking on the issue of medicine, right? I'm sure you deal in institutions where there has been cases, because in Inigumarani kwangu kune wanu wanengashoti unesiki tukubaya Jackson resiki bobo. So how big is the theft when it comes to these hospitals? Like how big is the risk of theft by the staff? Mshonga irubiwa ere muzipatara?
I can't say no.
Right.
I can't say no to that.
And you can't say yes.
Yeah, but I can say again. But what I think is that I think we have to put more security in our public health centers. The problem with that is that it means our patients, those who really need the medications, are not going to get them. And what we are going to do is to blame the government, right? To say, no, government is not providing medications and so forth and so on. But really, there's that issue. Yeah, I can say yes. I think to answer you, I may not. Of course, I don't have like proof to say. But generally saying, I'm just generally saying, I think there is also that loophole that I believe the government has to plug that. Otherwise, we'll keep getting even more complaints from the general population saying we don't have medications. Yet, some medications the government will be providing, but they don't last in hospitals because they are finding their ways out.
And when it comes to journalists, are journalists reporting responsibly when it comes to the health sector and your guys' practice in this country?
Yeah. I think you are not reporting responsibly. You guys act like...
I'm not a journalist. I'm just a guy from the street with a microphone.
No, I saw you on the mic. I saw on the mic the other way, one of them. But generally, the journalists, I think there are some who believe that they know it all, okay, and they know everything. But I think medical field is one complicated sector.
True that.
It's not something that... you see, for doctors, there are things that you may know that for this particular condition I'm supposed to be giving Prostate, but I may not give Prostate. For reasons that I know that according to this particular patient that doesn't need Prostate. I may do a certain procedure which according to you may think is not... that's not how it's supposed to be done.
So it's an ever-evolving practice whereby...
Yes.
If I come and I've got a certain condition, that means that you know that you can't pay this with this because it might have this effect.
Yes. Okay. So it means iwewe kana kwa ne condition yako uone hama yako yakaitwa certain condition yako, condition A, right? Ikaitwa certain procedure A anditi. It doesn't mean kuti ikakwazi yamwe patient ndikaita yauya ne same problem maybe ndoita in a different way, but I know I this way, that means I know this is. No, it doesn't mean that. Medicine is individualized to the particular individual. So my encouragement would be that the journalists, they have to get the information from Machiremba. And in any, I am always tweeting also. What I do at times, I also research. I also ask other doctors, other specialists in various fields. And what I usually do, I ask 2 or 3 doctors, compare, and then put my information that is factual. So I believe even the journalists, that's what also they have to do. Asking other doctors, asking other specialists, asking organizations, asking the Ministry of Health on itself, so that they get the facts on the ground.
It's an interesting fact that you brought about, because in any person I looked at ndichiri mugeto youth ndaingoti ndakaita oma symptoms andinongoitawo ndaingoenda pagoogle ndaingotenga bando rangu ndobva ndaenda pagoogle
Right.
ndobva ndangoti type ama symptoms Dr. Google vanobudisira answer. How dangerous is it googling your symptoms and trying to get because imati munotawo research natural research?
Very dangerous. Dr. Google is very dangerous. If you have noticed that whenever you put some symptoms on the Google, what it gives you is this complicated, difficult diagnosis. For example, if you say you have headache, it gives you could be having a
brain tumor. Yeah.
You have a brain tumor. If you say you have diarrhea and vomiting, it tell you probably you have a stomach cancer. For example, and those things, they are giving you anxiety, they are giving you unnecessary restlessness. Right. What my encouragement will be that you talk to Dr. Google, or you consult with Dr. Google after you have been given a diagnosis by the doctor.
Yeah.
Not before. Otherwise, even your mental health, I believe, is not good for a minute. And also the other problem is that once someone has Googled and then they come to the doctor, they already have their information. You start telling them something.
They are telling you, no,
yes,
Google said.
Google said this and this. Like I'm saying that, you see, the issue of treatment and medication is individualized, right? Your particular case may be different to, and also let us also remember that most of these things which are put on Google, they are not African-based. They are Western-based. Most of the information that's there. And we generally do not share the same diseases and conditions and even the treatment. Of course, nowadays, because we are adopting the Western lifestyle, the Western way of living, we are also adopting their diseases, hypertension, cancers, diabetes, and whatever. But generally, that information, it's according to their side, and it works on their side. Now, many of the diseases which are common on that side are not common this side. Right, you see. So now you give yourself a diagnosis which is not even common in our own setting. That is another danger of Googling.
Have you, like, you're a fairly young man, have you faced a lot of prejudice when it comes to your age, when patients come through and then you rock up with your stethoscope and then they're like, have you faced that in your career?
Yeah, I faced that. Unotora neface yemunhu kuti hazi kundisizes. Wana neface and if you have noticed nowadays than kudhara uko we go to kuta my junior doctors, how you be feeling young, even your face. And anyway, is doubt not when I look at a first year junior doctor, they are young. I know I'm young, but I'm saying,
but you don't trust them to actually come in.
So there's that thing. But in the way that I've tried to overcome that is kungotoka confidence.
All right.
What I've noticed that even if when a patient comes and they already have their own mindset, this young doctor, what is he going to tell me? What is he going? Do you think there's something that is substance that is going to talk about? But when you know your things, when you are confident, you talk to your patient. The condition that you have is this and this and this and this caused by this. You are very much eloquent. You know your stuff. You are confident with what you are saying. I've noticed that they start to be changing their face. And then they start to show some confidence in you. And they start to asking you, to be asking you questions. And then you say, this person now, is now enjoying. So I think the thing is, even if when patients see us that way as young people, and I think also even the female doctors, it even affects them more. There are people who just believe that female doctors, they are not competent. for some reason they believe nurses it's nurses who are supposed to be the females and the males is supposed to be the doctors. Yes. So also the my female counterparts also they face that. But you see, now we know that really what a man can do. Also, I mean, generally, of course, but we're saying professionally in things like medicine that we are very much competent. In fact, women can actually be more competent, It just depends with the individual.
Like my landlord's daughter is a doctor as well. She's a brilliant doctor. Tanya.
Yeah, you see.
Shameless plug. Next month.
So really, it just depends with an individual. And that's what I have learned, and that will be my encouragement really to anyone. Isusuma machirembe chidiki. You see, even in India, I mean, or your friend.
Ninde chofunga kuti doctor wachatoza so iwe ndio ngotorika
then you see a young doctor coming, but I have learned it's all about confidence. Even at times when you are not even very sure of what you are saying, I've also learned that saying that this particular condition, I'm going to refer you to so and so because he knows better about it. That thing is not a sign of weakness. I've seen patients can actually respect you for that. In any case, they know that you're a young doctor, right? So on top of confidence, it's not always to be overconfident again, but kungora confidence mnano believe.
Masley Queen by Instagram, Urumazia.
Right.
Urwazia, right? Tell me, what are the dangers of there's this new trend where people are going to get Brazilian butt lifts, BBL, people are getting but are red in town.
Yeah.
People are getting this light skin and it's the green is from Budikira. People are getting this people are
black.
Exactly. Via and they're getting butt lifts and whatever. Tell me, what are the dangers? What are the pros and cons of those processes? Light skin, light skin lightening creams and stuff like that. What are some of the dangers?
And these hairs and so forth.
Yeah.
So that before we even go to the medical aspect of it, I believe that you just have to be proud of yourself, especially the black people.
Right.
Those are the ones who wants to be, they want to look like the whites. You never see the whites who want to look like the black people. It's always us who wants to be copying and wanting to be like the black people. We want to be having long hair like the white people. Rather, we want to be having long hair. Well, these are probably maybe signs of that the colonization was very effective, but and this thing of white supremacy and so forth. So I believe the main thing to deal with this is people should be proud of themselves, right? As a black person, no one wants to be like a black person, right? So why should you want to be like a
white person? Yeah.
Why are you letting yourself? Why are you having these long hairs? Why and all these things that you mentioned? We want to be, like white person, and that is on the general side of it that I look at. That it means that you have low self-esteem.
True.
You don't have confidence in yourself, and even when you are talking, the problem now is of course you are making your skin lighter, but it may mean also what you say and other things which are inside. They remain inferior. But I believe that we should be proud of our, like I said, no one wants to be like a black person. Why should I be like a white person? But obviously, any surgery has its own complications. And that is why we say for any treatment that we do, surgery is the last resort.
Okay.
It's always the last resort because it is its own complications, right? But now if someone is having surgery for fun, then I'm actually speechless to say, are people not aware that even on the people who are sick, we avoid surgery?
Yeah.
But now for someone who is already okay, they want to have surgery. And the main idea, I believe, is to please people. And remember, you can never please people. You can never please anyone. Even when you get the hips and the whatever, there are people who still despise you. Right. So that doesn't. And what if one day you wake up and you no more want those things? You feel like these things are no more me.
Yeah, what
will happen? How are you going to reverse? Now you see, because as you grow older, you notice that such things are not necessary. That's what I believe. That as you grow older, and then now you want to reverse, and now they are irreversible. So I wouldn't encourage those things. Every surgery has its own complication, and this thing of lightening, there are also cases of it increases your risk of of cancers.
Serious?
Right? Yeah. So I don't see a reason why someone who should put him, rather herself, it's usually herself, at risk of cancers and other skin diseases, because they want to look like a white person who never wishes to look like us. You see.
No, I hear you.
So I think it's not necessary at all.
You are a very passionate person when it comes to young people in the region, in the continent, and I commend you for that. And you are dealing with cases of, back in the days we knew that the only drug was marijuana, right? Now you're dealing with some complex drugs. You're graduating from. We thought that bronchiolitis was like cough syrup was the top drug. Now we've got now crystal meth and whatever. Tell me some of the cases and some of the experiences that you're having with these kids in hospitals as a doctor.
It's very bad. It's very bad. It's pathetic, and it's sad, especially on the young people. You see a young person who is a psychiatric patient. I'm trying to look for a word but I'm sure our people can understand the psychiatric patient, right? Talking to himself, beating people, wandering around, and if that person is a young person in the teenager up to around 24 years, the chances that the cause of that is drug-induced psychosis, or the diagnosis is drug-induced psychosis, are very much higher now more than ever, right? So you can easily tell you someone is getting in, and you see that person is got the parents are struggling with this a kid, right, or this teenager, or with this person in the early 20s. They are having this symptom, talking to self, and they are violent. It's likely drug-induced psychosis. And it's not only in Zimbabwe. Now this is an African, or rather, let me talk about the SADC issue, or rather it's an African issue, or maybe we can even say globally. Yeah, because some of these things you see is the things that we're seeing on TV, and our young people are believing it's fashionable. It's fashionable. And the drugs that they're now indulging in, those drugs, they are even causing this issue of psychosis, like I've said. And our neighboring countries, again, is another big problem, that people who are coming from those neighboring countries, when they come here with these symptoms, you know that high chances are that it's psychosis. So it's very high. But one of the causes, like I've said, is our young people are believing is an in thing. That's a fashionable thing to do, not knowing that it's literally causing psychosis. It's not like I'm dramatizing or I'm scaring people. No, I'm saying it as it is, that drug-induced psychosis is the cases are much higher than ever before. And
for some of our audience out there who might not understand the term psychosis, can you break it down to, like, when you're talking to grateful language?
Yeah.
What's psychosis?
Yeah. So someone being mad, right? being we can call some say a lunatic, but let's just use maybe the word mad, or someone we say crazy, not the craze of our lingo, but someone, like I'm saying, let me talk about the symptoms maybe for people to understand. We're saying someone who is talking to himself, being violent, wandering around, runs away from home, they are beating people. All those are signs of, that's what you call psychosis, or someone just being made. And we are saying that among the young people, the commonest cause of that is nowadays this drug, is the drugs that they are taking. Yes, and I don't believe in this idea that it is because people don't have jobs, that's why they are indulging in the drugs. Because you notice that some of these drugs are very expensive. Yeah, and then also you notice that it's also even the rich kids are having these drugs. I remember. I'm sure you have heard of that case. It was one of a local
Oh yeah.
private schools. Yes, yes. So those people are not poor, right? And these customers and so forth, these things are not cheap, right? And you need them every day. So the idea that the people are taking because they don't have money, I don't buy it. I think I will buy the idea that it's people are seeing it as an in thing, as a fashionable thing, but it's destroying lives, like literally destroying lives.
People, especially men, young men out there, people are depressed. People are committing suicide. What can be done at an individual level, at a government level, to curb this depression and suicide rate regionally? What can be done?
Yes, men are generally at a much higher risk of dying from suicide. Much higher, probably six times to women as well, because men, there are less men who try to commit suicide, but when they do that,
They actually are successful.
yes, they are successful. Yes, but for women, more of them.
They attempt, but they're not successful.
But their ways of suicide are just these low key things, right? But for men, they are serious and they mean it, right? So if it's very high. But also, what I've noticed recently is a number of these cases is because of these things of infidelity and so forth, right? I think the boy child has to be taught or fails to deal with the issue of being cheated on or infidelity.
Okay.
Right. But what we need to know is that at every hospital, there are people who are just sitting like what we are doing, waiting for us to go there with our problems. Right. They are called psychologists. They are called social workers. Those people are there in every hospital, including the district hospitals. Right. So if we can go even at schools, the universities, of late we have heard of cases of university students who were committing suicide.
Right.
But in all these universities, including the University of Zimbabwe, I know that there are counselors who are ready to help the people. And also, I believe that another easy way that my encouragement, this is my own assessment and my own encouragement, is that if you face a problem that you feel is killing you inside, right, it's causing you depression, just talk to someone. But I wouldn't encourage you to talk to someone that you know, a relative or a friend, but a stranger. You get in your combi, you just talk to the next person. You get in some strange place or whatever, maybe it's a restaurant or whatever, you just talk to the next person. At least you are guaranteed for confidentiality.
No, continue. Sorry.
That works. The problem is if you talk to your friend or if you talk to your relative, is it they end up talking to the other people. This person is going through a lot. But if you talk to a stranger, I believe that helps.
Tell me, what are the 3 things that you love about being a doctor in Zimbabwe?
One, our patients, they appreciate us. That's what I've noticed. I did recently a poll on Twitter after I noticed some journalists who were, sort of like against the doctors and so forth. I did a poll and then almost 70% of the people, I was asking whether doctors in Zimbabwe are good or bad. 70% are saying they are good, and then the comments were more of they're excellent, whatever. So one, even in hospitals, I've learned that as much as we may not have the sophisticated machinery, the sophisticated material, and that all treatment that we may need, but the patients they appreciate. So that's number one. I like how our patients appreciate it. And then number two, I obviously like to be a doctor in Zimbabwe because I'm dealing with the people of my own. It's just good to help someone of your own. You help a child, you help your mother, you deliver a mother, then it's going back home with a child, happy. You see, someone comes to a hospital and they are sick, and then you treat them, then they go back home. You see, so that also of someone going back home fully recovered, it gives me some
so much joy. Yeah.
Yes.
Ladies and gentlemen, you may agree, you may not disagree with our opinions, but at least we started the conversation. This has been the Bold Exchange.